Astria Health closed labor and delivery services at its Toppenish Hospital due to financial issues, and now they're out of compliance with Washington State Department of Health regulations. KVU's Emily Goodell spoke to Astria Health officials about what that means for the hospital moving forward.
In December, Astria Health announced that while women in labor would still be able to deliver in the emergency department at its Toppenish Hospital, it would no longer be providing labor and delivery services.
We had to close labor and delivery at Toppenish Hospital because we had lost $3.2 million just on that service line in 2022 alone. Closing that service line, it triggered an out of compliance status.
Because when they bought the hospital in 2017, they agreed in a certificate of need filed with the Washington State Department of Health to provide certain services like labor and delivery for the next 10 years.
Our very first thing was to call the certificate of need office, work with a certificate of need consultant to do this properly.
They've now filed a letter of intent with the DOH to amend that certificate.
To remove all of the conditions from our certificate of need.
KVU reached out to the Department of Health and got a statement saying they're aware of the situation, that Astria Health is working toward a possible solution, and it's too early to know if any disciplinary action might be needed. They say they'll have more information once the process is complete. In the meantime, Astria Health officials say they're in a better financial position without labor and delivery expenses.
It has absolutely generated savings for the hospital. There are absolutely no plans to close any other service.
The hospital still dealing with the loss of their 150% Medicaid reimbursement rate.
Toppenish Hospital falls through the cracks in terms of rural health funding. We just don't fit, and at the end of the day, there's a health equity issue.
But lawmakers are trying to help with Senate Bill 5532.
This is a bill that I think is vitally important to this little hospital in my district.
120% of Medicaid reimbursement for inpatient services and 200% reimbursement for outpatient services. That bill passed unanimously through the Senate, and it's now going through the House.
But when it comes to bringing back, adding, or expanding services,
we don't count on any of that money. All of the decisions that we make are based on the money that we have right now that we're collecting.
In Toppenish, Emily Goodell, KVU Local News.
The bill has been introduced in the House and referred to the Healthcare and Wellness Committee. If the House approves, those reimbursement rate changes would go into effect in January 2024.